Hey everybody, John Malanca, United Patient Group. Happy New Year to you all. Just finished a podcast with Dr. David Gordon. He and I have worked together in the past, and I wanted to get him back on our show. But he's an integrative and functional medicine doctor, working with 4 different pillars and bringing health and balance back into his patient's lifestyle, and then now incorporating medical cannabis. He's been in the cannabis industry for about 10 years, and he's just a well-rounded physician. And based out of Colorado, he's right there at ground zero, and he's seen a lot, and he worked a lot of patients, everything from pain, sleep, anxiety, as well as serious ailments such as cancer and fibromyalgia pain. So I know you'll enjoy this. He's a great guy, and thanks for being back on the show, Dr. Gordon, and we'll see you soon. Welcome back, everybody. This is John Malanca with the United Patient Group. Be informed and be well. And today's special guest is someone I've worked with before in the past, Dr. Dave Gordon. How are you doing, Dr. Dave?
I'm doing well. Thanks for having me.
Thanks for being on the show. Let me read your impressive bio, but Dr. Dave Gordon has more than 20 years experience working with patients. His passion is providing non-pharmaceutical options for chronic disease prevention as well as treatment using 4 pillars: food, movement, relaxation, and community as cornerstones of an integrative approach, which I'm a big fan of, and I live that life as well. He received his medical doctorate and completed residency training at the University of Colorado and remains on the clinical faculty. Dr. Dave is a board certified in internal and in integrative medicine and a certified functional medicine practitioner with the Institute of Functional Medicine. For over 10 years, Dr. Dave has reviewed research on cannabis and our endocannabinoid system and witnessed the safety and effectiveness of cannabis while working with patients. He's excited to be on the forefront of cannabis medicine, bringing that knowledge to patients, practitioners, as well as the general public. Well, cool. And you're out of Colorado, right?
I am out of Colorado, originally California, born and raised in Los Angeles,
okay.
But came out to Colorado for medical school, and it's too nice to leave here. So been
here
ever since the 90s. Yeah.
It's good because a lot of people don't like the cold. I have some friends that grew up there, and when they got, when they're able to get out, they're like, okay, I want to go to California to warm up. But you're from the warm climate, and you went over there and you get a few different seasons too. So, I do a lot in the cannabis industry, and so why I wanted you, as well as the integrative oncology world and functional medicine. And so, can you talk about what's the difference between integrative as well as functional medicine? What's the difference, and then how you're incorporating that into medical cannabis?
Yeah, absolutely. It's a great question. The way I describe it is I describe integrative medicine is really more of a bigger toolbox, really looking at a variety of different ways to deal with certain issues, conditions. And I kind of that's how my career kind of started. After my residency, I went into practice and quickly kind of was exposed to other practitioners, chiropractors, acupuncturists, psychologists, and said, okay, I'm going to use these resources. So rather than just prescribe medication to everybody, which is kind of, I'm oversimplifying a little bit, but which is kind of the standard of care, it was this integrative approach. Let's use all these different tools. Let's understand more about a patient's lifestyle and counseling and education. So that's kind of integrative medicine, at least how I describe it. Again, just really opening up the toolbox, both on how you evaluate patients and then certainly how you treat them. Functional medicine is a term that's really only been around 25 years or so. And it's kind of a type of integrative medicine, I would say, but it's a little more specific focus, whereas functional medicine is really the mindset of how you approach conditions. And really it's this concept of let's approach it by the root cause. So rather than just label diagnoses, someone's got migraines or someone's got lupus, and then we're going to use maybe an integrative medicine approach to treat them. We'll use acupuncture, we'll use prescriptions, we'll use botanicals. Functional medicine says, well, what's the root cause of your disease? Why do you have migraines? What are the system imbalances? And you just keep going upstream further and further till you identify these root causes. And then you treat the root causes. You don't really treat the symptoms per se, you treat the causes of them. And that's a pretty unique philosophy. And that's really the difference. There's a lot of overlap, but functional medicine is really a philosophy and kind of a paradigm in and of itself.
There is a lot of overlap, and my doctor for the past 10, 11 years has been naturopaths, and they look at the same thing, how different way of approaching compared to just, here's a pill, Dr. Dave, take it, and call me later. And I'm liking the way that cannabis is not a one size fits all. The same thing with integrative as well as functional. The problem with integrative, I just finished hosting and moderating a integrative oncology conference, which Corinne and I've been involved with for the past 6, 7, 8 years. And, and we offer CMEs to these international integrative oncologists. It's funny though, because with this one organization that was certifying, that Corinne and I have used in the past, that was bringing it over to their organization, they weren't allowed to become an accredited body, meaning, or for the organization, because functional medicine and integrative oncology or integrative approach isn't approved by the FDA. Do you run into that? Different, they do, well, at least for the integrative oncologists, they do everything besides chemoradiation. And they're saying, well, stem cells aren't approved. Ozone's not approved. So we can't certify that as a continuing medical education, at least for this other. We did end up working, but do you run into that? That other I guess the AMA doesn't really frown upon is not that right word, but look at them like, hey, you're not following the guidelines. Is that something that you run into?
Yeah, in a variety of different ways. And no, sometimes, at least when it comes to CME, continuing ed, definitely have been able to do some formal continuing ed, at least in the cannabis space, I would say.
Yeah.
But even within the Institute of Functional Medicine, there have been some courses that are CME eligible and things like that. So I think it brings up an interesting point. The challenge of kind of, what's approved, what's standard of care, what's evidence-based medicine, that's kind of where the challenges have always come up, not always on the CME side of things, but more when just discussing, you get often just a wall put up immediately. If someone hears the term integrative medicine or functional medicine cannabis, you'll hear things like, oh, there's no evidence for that, or I only do evidence-based medicine.
Totally.
And that is a pretty, I guess, frustrating take on my part, because it's this, we've created what we call standard of care and then say we don't do anything that's not evidence-based medicine. But in reality, the bulk of our standard of care is not supported by the evidence in so many different conditions. Certainly some areas there are. And that's what's frustrating to me, is kind of the people who kind of make the rules of what standard of care get to say, well, what you do is not evidence-based medicine. What I do is, even though there's no evidence to support it. And that's a pretty frustrating topic. I mean, just to give you an example, I think it was last year, now 2 years ago, 2019, JAMA, the Journal of American Medical Association. So, one of our major journals, posted the guidelines for the American College of Cardiology and, all our heart disease guidelines. And only 8% were supported by what you call like level 1 evidence, large scale, double blind randomized trials. So this is cardiology, the area we have the most research of any specialty, and yet only 8% are really supported by what's considered the great evidence. So when people say, oh, in cannabis or functional medicine, you're not evidence-based, I'm like, well, you're not evidence-based either. You just get to make the rules. So you get to say whatever you want. And that's kind of the area that I run into. It's pretty frustrating when trying to introduce concepts to people and they immediately just put up this wall and don't kind of acknowledge that what they're already doing isn't any more evidence-based than what I do.
It's tough, being a health advocate and a patient advocate and also a caregiver with my wife. That was the thing that really frustrated us, that we would go to main institutions, Stanford being one of them. And when we shared we were using cannabis and other non-evidence-based, methods, they totally, they put me in a whole different category. It's like, well, there's no proof about that. Why would you do that? I'm researching. When you're thrown into something of health and wellness or sickness, you'll do anything for yourself and most certainly for your wife or your loved one as well. If something works, when you get that diagnosis, you'll try anything. And I always talk about that. If someone said, eat a blue pen, and it has killed cancer cells, you better believe I'm going to start eating that blue pen. And it's disappointing that, like you said, oh, it's not evidence-based, and they kind of turn the cheek and not really take this side of the medical practice seriously. I've worked with a lot of oncologists, both integrative as well as conventional, as well as a bunch of functional medicine. I just feel that having the toolbox bringing to the table when you're battling diseases as serious as cancer and others. Why not have an arsenal, and even work together, like cannabis. Cannabis works together, and I don't want to have anybody ever, if they've been diagnosed with cancer, not go the conventional route. I would never talk anybody out of doing that, but you can use them simultaneously. And do you hear this as well? I'm going to try this, and if this doesn't work, then I'll try this.
Yeah, I hear both. I mean, people coming to me obviously are already kind of interested in looking at a broader array of options than they've been given. So when folks are coming to me, that's probably less of an argument. But when I'm talking to clinicians, or when I'm talking to patients that are, maybe not coming to me for a visit, but they're just after a lecture where it's the first time they've heard of something, I'll really say, well, what are your goals? And then when it comes to, well, what about this physician? What do they say? Or, you're not evidence-based. I say, well, really, how are you describing evidence-based in terms of thinking about all these options? I mean, I describe evidence-based kind of based on how it was originally defined about 20 years ago, which was actually three prongs. It was the best scientific evidence, the clinician's opinions and experience, and the patient's goals and preferences. And using all three of those is really truly how evidence-based medicine was defined. So when I talk to a patient and they're looking at it, I say, well, what we're doing is evidence-based. And what you said when you were working with Corinne and you're doing the research. So when I look at a patient, say with cannabis and cancer or any other condition, I'm going to use all the scientific evidence I have, not just one study that fits my, viewpoint. I'm going to look at all of it. And then I'm going to say, well, what's my experience with patients? What are other clinicians' experience with patients? And then I'm going to say, well, what are the patients saying? Well, I've got a huge battery of data, for example, in cancer that says, well, cancer patients who use cannabis feel like it helps and really feel like it's a valuable part. I'm not going to exclude all those patients because they weren't in a randomized trial. These are real individuals struggling with what you obviously know is a life-changing diagnosis. So I think using all these tools is true evidence-based medicine. And if we approach everything that way, one, we kind of would do better for our patients, but really be able to then do better with the hard clinical research that we all want. But if you don't acknowledge something even has the potential to help, why are you going to bother investing research in that? And so I think some of it for me is just describing it in that terms for patients, for clinicians, and say, if we ignore the patient side of it, we're never going to get great patient outcomes.
And you talk about ignoring the patient. As I keep on saying that I work with integrative oncologists and functional medicine. The first conference that Corinne and I attended, I want to say now, 6, 7, 8 years, probably about 7, 8 years ago. But the very first one we sat in on after the conference, they did a panel, a discussion with the doctors up there, and someone in the audience said, what steps do you approach a cancer patient when they come to you? And to our surprise, and I was pleasantly surprised, they said, first off, we asked, what their home life is like. What their home life, are they married? Do they live alone? Do they have a nice relationship? Do they have children? What's their religious background? Are they into spirituality? Are they, they practice any type of religion? Are they open to this? And then they ask them about praying, which blew my mind that a doctor would even talk about praying. And then they say, what is your will to live? And then we go to the patient. And I just think for showing the patient that, for these doctors to show the patient that they really care about the patient, and then then they're going after treating the ailment. They do all these first, then go to the treatment, and they know where they are with that patient. Everyone's different. And sometimes I don't want to ever give false hope, but sometimes giving that hope and giving that extra pump, like, oh my God, my doctor's on board. My doctor's is part of this. And I think that's the thing I really enjoy about the integrative and functional medicine part of this, where they can incorporate, I'm a big fan of chiropractic, acupuncture, meditation, naturopath medicine, the list goes on,
Yeah.
and if you can do that. So in the same thing, even with your 4 pillars at the beginning of your bio, I'm a fan of all those as well. In your practice, what are the common reasons people come to you when they turn to cannabis therapies? What are they asking for? Is it a wide variety of patients that come in?
It's definitely a wide variety, but there are no doubt some things that kind of rise to the top. I think still pain management is still far and away probably the most common thing. One, it's probably the thing that's most talked about in the lay press and things like that. It's also one where other options are really poor, especially the opioid issues. And there's so much now press over the last 5 years about that. And so people are now knowingly afraid of it, whereas before they were just, well, my doctor says this is fine, so I'm going to go about it. Now you don't need to really do your own research to know the risks of opioids. People who are a little bit more knowledgeable start knowing about the risks of things, even like Tylenol or ibuprofen, which are not small in any way, shape, or form. So pain management is certainly, I think, still the top. I would say the combination of kind of mood disorders and insomnia, if you kind of lump all those together, would be high up there. Anxiety, depression, trauma, sleep, it all certainly kind of goes together. I'd say that category is prominent. And then you get into other, chronic diseases that, certainly overlap with that. Cancer is another big one as well. People, again, like yourselves, they certainly know there's a role for cannabis in cancer, even just in symptom management, beyond the potential for its chemotherapeutic benefits. So really, they're not getting guidance from their primary oncology team most of the time, although there are areas where there's a little better guidance. But so those are probably the three biggest. But I would say there's no kind of condition someone hasn't come in with on some level. Yeah.
I mean, nowadays, there's some conditions that really weren't around when you and I are probably in high school and college, that are today. I never heard, you hear more about things today than you did back then. Maybe you were in the industry. Maybe that's why, and working with a lot of people. Sleep, you mentioned sleep. Sleep's important.
Yeah.
And I truly believe it's a domino effect. When you're lacking on sleep, everything else, kinds of fail. Your eating, your depression, your anxiety, pain. A lot of pain patients find, when they don't sleep. We've done a few podcasts on pain, and one Beth Dost and Claudia Morandi. Sorry, Claudia. They are doing a lot with the pain world. Beth has been working with us. She's a nurse in this industry, and she has fibromyalgia. And so it's something that, she, as a nurse, she just discovered cannabis about probably 8 years ago. She was at a conference and she sat there with her mouth just dropped. Like, how come I never learned this? I've been a nurse for 25, 30 years. And so now she's incorporated that, but she's someone who battles fibromyalgia. She gets up at 3 a.m. to get out of bed at 6 because she's in so much pain. Knock on wood. And same for you. I'm not in any pain, and I hope you're the same. So I don't see that side. What she has found and what both she and Claudia are working with is fighting for pain patients, not only here in the US, but globally. And, they find success in the positiveness of drug-to-drug interactions, lowering the pain dose with the pain medications and having, say a 25 milligram pharmaceutical product using cannabis 2 to 5 milligrams, and lowering the pharmaceutical product and getting the same amount, same results, I guess, as a 25 milligram capsule by using a cannabis product. Do you ever mix and match with that? I always tell people, don't do it by yourself. Make sure your physician is involved. So
Yeah.
that
Yeah, definitely. I would say a lot of it is for me, folks who are already on other pain therapies,
yeah,
maybe opioids, and saying, hey, I'd love to get off or reduce them. And I say, okay, well, let's get this into the mix. Let's get you feeling better. And then here's a way I can work with you to taper. You can work with your primary doc. I like the latter because I love it when patients go to their primary docs and go, oh, I'd like to taper down on my opioid pain medicine. And the docs are like, well, I don't usually hear that very often, but I'm feeling great. I want to taper down. So it's a way to educate other docs. But even something you were saying before with fibromyalgia and sleep and this discussion, this kind of integrative medicine or discussion of what the bigger issue of the patient, pain's such a great example of that. So if you just say, wow, we want to look at pain. We want to look at your 0 to 10 pain score. And that's the only marker we're going to do. And we just assume as physician, we're just going to beeline because that's what, maybe the randomized trial looked at, just your pain score. But when you look at a patient, they don't necessarily always say, oh, my primary expectation or my primary objective is just to have a lower pain score. Their objective is to be with their grandkids. Their objective is to go for hikes. Their objective is to have high quality of life. And so when you frame the discussion that way, you also then say, I've had plenty of patients, if fibromyalgia is a great example, they add cannabis to their mix or some other integrative tool, nutrition, whatever that is. And after 3 months, they might actually say like, oh, my peak pain is still 7 out of 10 or 8 out of 10, but I'm sleeping better, my activities are better, my mood's better. And so technically, maybe we didn't actually reduce a pain score, but we clearly improved the health of that patient. And over time, pain can get better. So I think some of that is looking at the big picture. And that's unfortunately what randomized double-blind studies don't do. They specifically don't look at the big picture. They specifically just take one variable and try to make a direct line to one specific outcome. And that's valuable, especially in kind of acute illnesses. But for chronic disease where people have overlapping symptoms, don't have direct, single causes of those symptoms, It actually is really a bad type of studies designed to truly evaluate a patient. So I think fibro is like a perfect example of how you need to look at a patient and really look at evidence-based medicine in that true kind of big picture, through the forest rather than the trees model. It's really in our patient's best interest to do it that way.
Because of Beth, I've learned so much about fibromyalgia and what she goes through. On the outside, she looks like she's ready to run a marathon. The inside, she's, her husband and family and kids and grandkids are like, come on, pick it up. You look great. She just said, she calls it the silent, I don't want to say silent killer, but silent, and the invisible pain. On the outside, she looks fantastic. On the inside, just bam, 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 and all the nerve endings are going. She runs in, and I don't know if you run into this with your patients or in Colorado. She's over in the New England area, and they're pretty strict. Like her doctor, now doctors are being red flagged. Do you ever get any of these warnings from doc? Are you part of that?
Yeah. Well, I'm not. I mean, I know of it now.
Yeah.
But it's kind of almost funny, even funny, maybe not the right word, but yeah. I never used opioids really, period. Like I couldn't even tell you in my 20 years of practice how many new opioid prescriptions I initiated, period, even long before cannabis was part of my toolbox. Again, just being an integrative doc and working with chiropractors and acupuncturists and nutrition, I never needed them. So even in 2014, 15, when all the opioid crisis news was coming out, I actually was like, well, what's this opioid crisis? I'm not familiar with it. I don't have any patients who are taking chronic opioids, and realized the scope of the problem was so big. Now, when the crisis kind of became elucidated, now regulators are penalizing doctors who prescribed opioids and all these different things. So what you now is patients who were started on opioids, basically given an addiction by the medical system, and now put into withdrawal by the medical system because now doctors are afraid to prescribe them. Sadly, a lot of those folks turn to, street opioids and heroin, and it's causing, literally life-threatening consequences. So I'm now very much aware of some of the regulatory and the kind of the big picture of the
Yeah.
opioid crisis. But for years, I was oblivious because there was never a need for opioids in my practice, despite seeing a pretty sick patient population, especially one with chronic pain. But it's just when you don't think pharmaceutical first, when you think root cause first, and when you think what's the safest, least invasive way to treat someone, which are the hallmarks of both integrative and functional medicine,
Yeah.
it works. So you just don't you need the pharmaceuticals usually for the acute life-threatening stuff. So yeah, there's people who get pneumonia, they need antibiotics. There's obviously other conditions where the pharmaceuticals come in play. But if you're thinking pharmaceuticals last, most of the time you're going to get to your resolution before even needing them. So it's true for kind of antibiotics as well. I never had a antibiotic overuse because I only used them in times when they were appropriate. And when you do that, they're not a problem for the most part.
You know, you talk about antibiotics. My mom's brother, my uncle, had a lung infection, nothing to do with COVID. And I said, how is he? He's like, oh, great. They're going to put him on, ready for this one, 45-day antibiotic. And I said, Mom, you better get him some probiotics. You know, she's going to rip 40. I mean, that's a long time. 45 days to be on an antibiotic. Is that common?
It's really the place it's most common is in bone infections. That's kind of the standard for a bone infection is 6 weeks of IV antibiotics. Lung infections are a little atypical, although there are some what we call atypical infections, TB, mycoplasma, some other things, maybe some fungal infections where longer is done. But again, when we go back to evidence-based medicine, I'm going to guess, obviously not knowing the details of this specific case, but I would bet money that if you took the details of that case and said, oh, is there a randomized trial showing that 6 weeks or 7 weeks of antibiotics is appropriate for someone with that background, my guess is you wouldn't find that data. So again, not evidence-based medicine based on what kind of the system is saying is true evidence-based medicine.
Yeah, and I don't know all the details either. So, but when I just heard 45, that stuck out. I'm like, oh my God, that's heavy duty on the gut. I'm very aware of what I put in my body, and health and wellness is part of my lifestyle. And like I said, I'm not in pain as well as I was mentioning earlier. But let me back up of what's happening to the East Coast, not only the East Coast patients, but that are on the pharmaceuticals is, if they have a month-long supply of their pain medication and they run out on day 28 because maybe day 18, there was so much pain they had to take two, and then when they go in there on day 29 to refill it, now they're on a list, the red flag list. And it just, I'm not in any pain, thank goodness. And so, but a lot of the patients that we work with on a regular basis are in pain. Talk about cannabis and pain. That was the one thing that, it didn't help Corinne. And she's like, how's this not working with me? In pancreatic is just a different breed. And she didn't want to have the pain medication. She didn't want to have morphine, and whichever, when you're at that stage, take this, and it but she wanted to go the natural route because that's what we've always done is the integrative and functional and of way of life. And do you run into that where sometimes it doesn't work with patients for pain?
Yeah, I think for pain and for all conditions, there's certainly no best treatment or kind of the only treatment that works. I find with pain issues, I think neuropathic pain, where really the nerves are inflamed and hyperactive, I think that's where I see the best results. Also with kind of central acting pain conditions, that's how we would describe fibromyalgia, where it is the nervous system is involved, but it's not one specific nerve, like it might be with sciatica or diabetic neuropathy, things like that. So that central acting kind of pain condition or the neuropathic pain condition, I see things where it works the best kind of arthritis where you've got bone just rubbing on bone. I think I've seen and had success with a lot of folks, but there are certain times there where it's not. And some of it is what their kind of body needs. For example, if it's, even though cannabis is a great anti-inflammatory, there's other anti-inflammatory regimens that might work more effectively. If someone's endocannabinoid system is really functioning optimally and overall doing really well, adding more cannabis may not really support them as much because you're really optimizing your receptors. So there's patients where it doesn't work, and that's again the beauty of having different options for folks and using combinations, but also time with patients, because when people say cannabis doesn't work sometimes for pain, it may not be in Corinne's situation because you guys are knowledgeable, able to try different products and regimens. But a lot of people hear, oh, cannabis is good for pain, so I took this one thing, it didn't work, and they just say, oh, cannabis didn't work. Well, okay, this one product at this one dose and this one ratio didn't work. But cannabis is a big term. And so I tell people all the time, I have people come in and say like, oh, cannabis hasn't worked for me. I'm like, well, this product hasn't worked for you. We've got a lot of different options. And I think there's a big education gap, both for patients and practitioners. We're so focused in our medical system on kind of single drug, single treatment. So it's easy to say ibuprofen, you only have a handful of dosages. It's, one chemical. So you can kind of say ibuprofen works or doesn't. Cannabis is hundreds of compounds. And depending on the product you use, different compounds, different ratios. So that's where we get more research to maybe fine tune the starting point. But I tell patients all the time, if you want cannabis to especially be your kind of primary Band-Aid, you got to be willing to work at it for 3, 4, 6, 12 months to try different products, titrate. If you just want to come in and say, oh, doc, tell me what to take for pain, and I'll take it, and I might get lucky and say, here's what works. But I usually tell people, no, I'll give you guidance, but you really got to be able to do the work yourself and find the regimen that works. And I would say the patients who do that are willing to spend the time, journal, take notes, spend 3, 4, 5, 6 months, work with me, work with other educators, groups like yourself and others. They're going to do well. The ones who just want cannabis to replace a pharmaceutical and want the quick fix, they might do well. We might get lucky, but I would say more often than not, that's not the case.
You said sciatica. That was the most pain I think I've ever been in my life. And I know my body, and I'm a big into chiropractic and acupuncture massage, and I could not personally adjust myself. And I did acupuncture, massage, chiropractic, stretching, did everything. I mean, I would have given $1 trillion to get rid of it. I mean, I went down to Costco and bought icy hot packs, my back, sat on golf balls, tennis balls, baseballs just to do that. And one day, I went down, I said, you know what? I'm a big fan of the inversion tables. And I went and bought one. And I would hang on it. And one day it just totally released. Yeah. And I have sold more inversion tables of people's like, inversion table, go try it. Nowadays you can get some great ones for $150, $200. Back in the day it was like the TVs, $1,000, $1,200 for a TV, and that like this size, and now you can go to Costco and get 75-inch for under $600.
Exactly. You bring up a great point, both kind of the beauty and to some extent the curse of integrative medicine. When you approach the world of, hey, I know there's a lot of things that can help, not just this narrow dogma of what we're taught in medical school. It opens up the possibilities, so many different tools, so many different treatments. So that's a beautiful thing. And especially, you're struggling and, hey, I've tried this, and now, boom, I finally tried something that works. So that's the beauty of it. The curse is where people start. And that's, obviously the one of my biggest jobs and kind of what I do a lot in my career is I learn as much about the patient as possible. I learn as much about the research as possible that's out there. I learn about all these tools and then say, all right, here's where I think we should start, because I could pick from dozens of different therapies, and not everybody has the time and the money to try 30 different things. So it's beautiful that there are so many options for patients, but when you really do personalized care and integrative medicine, it's a challenge to have so many options. As I say, it's a lot easier. When I first started my practice, and I practice what we commonly call up-to-date medicine. Up-to-date is like a medical online textbook where it just tells you, here's how you treat every condition. Yeah. So you just follow every algorithm.
Instruction manual.
It's really easy to do that. I mean, I stopped doing it because it didn't work, but it's super easy to be a very conventionally trained outpatient physician, because you don't really have to think. You just kind of plug in a diagnosis and spit out the treatment. Integrative medicine is a heck of a lot harder, because you have to not only learn about all these different therapeutic options, but then you have to make decisions on what's going to be best for that patient sitting in front of me. And so again, beauty and a curse when we go down this path, both for patients and practitioners.
And I like that the integrative and functional approach is it's like a fully you have a lot in your arsenal, and that's how I like it. And you spoke about sometimes it's not just the quick fix, which a lot of us want nowadays, but stick with it. And it's stick with it with anything, even working out, or getting on losing weight, getting on a diet. You can't just automatically think, I'm going to try. I did this diet for 4 days and I haven't seen anything. Stick with it. Same thing with cannabis, finding that sweet spot, finding that product. And not all products, and hopefully one day it'll get to that point where you'll say, you have cancer, take this. You have diabetes, take that. You have sleep issues, take this. Because not all, the perfect thing was when CBD popped out in those, well-known companies that everyone, jumped on because the media said. I mean, I can't tell you how many families I speak with on a regular basis just because it worked on one child. I have other families that every time their child took that product, they would throw up. And then I should try another product. It doesn't, just because it worked for this person doesn't mean it worked for you. And they move products and it works. The child's not having seizures anymore. So don't, what do you say about that? Because I don't want people to get frustrated. It's not working. And it's sometimes you have to, like anything in life, you have to change it up.
Yeah, I think I definitely see that. And I would even argue that I don't think we'll ever get to the point, no matter where we're at with legalization and scheduling cannabis. I don't think we'll ever get to the point where if you have diabetes, this is what you take, or if you have this condition, this is what you take, because that simply, at least for chronic diseases, never works. I mean, that is our single biggest failure in conventional medicine. It's not actually that using pharmaceuticals is bad. It's the one size fits all approach that we just slap a label on you and say, this is how we treat that label. I mean, that in a nutshell is the complete failure of chronic disease treatment in not just the United States, but really Western countries as a whole. And so if we just put cannabis, even if we say we're going to put $50 billion into cannabis research, it's completely legal. Yeah, we're going to get better information, and that would be great. But we're still, if we just put cannabis in this model of one size fits all therapy based on a diagnosis, we're going to fail.
Yeah.
It doesn't mean we don't do the research, because what I like to say is all the research in diabetes or in this type of cancer, it tells us where to start. So if we can narrow our starting point down, I think that's what the research is valuable for. But for every single patient and every single issue, we still have to have this range of where we work, because again, diagnoses for chronic disease, again, this is a fundamental difference in functional medicine and conventional medicine. The diagnosis really isn't that important. Diagnoses are important for life-threatening, or not even life-threatening, but for acute illness. It's very important to know if you have chest pain, whether it's a heart attack, an aneurysm, or a blood clot or pneumonia, whatever it is. That's very important because the treatment is very specific and different for each condition. But if you have cardiovascular disease, for example, the chronic disease that might lead to chest pain or a heart attack, everybody's cause for cardiovascular disease is different. So if you treat everybody the same, just saying, oh, it's all cholesterol, it's all blood pressure, and you just use a handful of treatments there, you're going to miss the boat. So kind of what I tell patients is try to kind of have that, let's step back and let me explain this philosophy to you. If you just worry about the label and what's the right treatment for that label, you're going to fail, because the labels are arbitrary. For the most part, they are created for billing and insurance purposes. And half the time the labels are just Latin for what the disease symptoms are. So someone comes in like, oh, I'm having burning in my feet, I'm having all this pain, and they come out of the doctor's office, they're so proud of themselves. I got diagnosed with peripheral neuropathy, and they're so proud they have a diagnosis now. I'm like, oh, really? Well, that's just Latin for your nerves are bad. Like, well, you knew that when you walked in. So I've used that as an opportunity to really kind of educate on what I just said, that the diagnosis should only be the starting point. If it's that one size fits all for your label, you're going to fail. So you always have to be willing to try different things and see what's best. And no amount of research will get us past that.
So I'm always the first to say that cannabis is not the golden pill, the golden ticket. And so do you have that same approach that cannabis is not always enough to treat the problem?
I don't say it's never, well, yeah, I guess I would say it's never enough to treat the problem. It might be enough to get rid of the symptom though.
Okay.
So if someone comes in with insomnia, cannabis might be enough to get them a great night's sleep without adding anything else to their regimen. Will it likely be a permanent solution for years or even more than months? Probably not, because if you don't treat the root cause, the symptom is going to persist, or a new symptom will come up. So there are very few people whose sole issue is cannabis deficiency.
Yeah.
So there are some folks who have endocannabinoid deficiency, at least we think. And so maybe cannabis might be a great long-term option without changing much. But even in that situation, we'd rather feed the endocannabinoid system. We'd rather make our own system function again, not just replace it. So there's always going to be something more, because you have to treat the root cause, or eventually that symptom's coming back, or other symptoms are going to develop. So it's, again, I look at more, I use the term cannabis as a gateway. I don't know if we talked about it when we chatted on the previous show. I mean, certainly cannabis has been called a gateway drug for decades, and the research really shows that not to be the case, but I still see it as a gateway, because cannabis introduces these concepts to people very well. Like, here's a short-term fix, but it's going to introduce a concept that we have to do more to treat the underlying condition. Or when people start learning about the endocannabinoid system and about how balance works and how homeostasis works and how all these other bodily systems work, that really opens your eyes up to how to treat patients effectively. And so I'm able to go from, here's why cannabis isn't a treatment for all these different diseases, or the treatment for all these different diseases, but here's an explanation of how cannabis can be part of the picture for so many different diseases, because it's creating balance and homeostasis. So I kind of turn it around and say, yeah, cannabis is not your sole fix, but cannabis is a great gateway to understanding how you can get to that fix while getting some short-term symptom improvement.
That must be the greatest feeling as a practitioner, to hear a patient call you back and say, Dr. Dave, I haven't slept for years, and I get those calls. You referred me to Dr. Dave, and he put me on, a regimen of cannabis for sleep, and I'm sleeping. Or my pain, I don't feel pain. Even my mom was like that. She was someone that I would never ever expect her to use cannabis, and she started seeing all her girlfriends from church or wherever using it for sleep, for whatever. And so I remember, I call her every morning, good morning, and every night, good night, and a couple of times throughout the day, just check in. And I remember one time, Crit and I were sitting there, and was talking to my mom, and she said, "Can I ask you something?" I said, "Yeah." And I'm on speaker, and she said, "Does cannabis work for sleep and pain?" She was a tennis player, and I said, "Yeah, why?" She goes, "Because I've been taking these little pieces of popcorn every night," and I was silent. And I remember Corinne's pushing me like, "Be supportive, be supportive." I'm like, I mean, having your mom say, I'm like, "Yeah." And is it working? She's like, "I'm able to move, I this and that." And it was funny. She didn't tell my brother for like 3 months. And my brother said, "Did you know mom?" And I said, "Yeah." He goes, "Why would you tell that?" So I love that story. And now, I mean, she's our walking billboard of, all her friends. Like, I have friends from high school that call me up and say, "Hey, I want to thank you. My mom's using cannabis because you and your mom." I'm like, "Don't blame me." He's like, "No, we've been trying to have this conversation with her for years." And I said, sometimes it takes an outsider to talk to share this with their loved one, before the family members do that. Have give them the approval to do that. I was going to ask you, you being a physician as well, and in your practice, at least out here in California and other states, um, a lot of people are avoiding doctors now because you were talking about legalization, and now what are we? 35 states medical, 15 states recreational, and not everyone's going to the doctors anymore. They're going straight to the dispensaries, and they're coming back with 5 or 6 different products. "Oh, I have anxiety. Well, take this. I have sleep. Take this. I have, eating issue. Take this." That frustrates me because I work with so many patients that call and say, "I have all these products," and I work with a lot of seniors as well. And I don't want anybody taken advantage of. I don't want to give anybody any false hope. But I truly believe medical professionals and practitioners should be involved. I know you're kind of in the heart of this in Colorado. Has that put a dent in your practice at all, or is it just you've been there for so long that it's just common?
It's definitely common, and I think Colorado, from my experience talking to folks, has a lot of the same problems that California has. That it's kind of a free for all.
Yeah.
I think where Colorado's done the best, and obviously being the first to kind of recreationally legalize it, I think areas we've done great is quality. Like, I feel very confident in the quality
Good.
of products that people can go buy at a dispensary.
Yeah.
So I think we've done very good there. Where we've done poorly, though, is the medical focus. And when we went recreational, I don't want to quite say it destroyed the medical framework, but it certainly put a big dent in it. And that medical framework wasn't great to start with, because most of the physicians who were giving out med cards didn't know a thing about cannabis, and it
Same
was
here.
just a factory. But even now, since Rec's gone into play, I don't know the numbers off the top of my head, but I think it's something like 90% of sales in Colorado are on the Rec side. And Colorado also has to separate from the seed. So when you plant a seed in the ground, you have to say whether it's a med plant or a rec plant, which is one of our absurd rules. So there's no value for most of these companies growing medical flower because they know the sales are going to be on the rec side. So it's basically pushed people out from physicians that even want to go there. And then, of course, the mainstream, so to speak, medical community doesn't want anything to do with cannabis. And then even when you go on the med side, half the doctors they talk to don't know anything about cannabis. So there's been no medical focus. I mean, I often see patients when I'm just doing some med cards, and I say, "Oh, here's some information, or do you have any questions?" They're like, "Oh, I didn't know I was allowed to ask questions. I've gotten this is my 6th year getting a med card, and I've known way more than the doctor every time I've come, and that's a problem."
It happens out here. I mean, I get calls the same thing. So I have my recommendation. What do I do now? And that's frustrating because we get these calls every day. And I just think if a doctor or a medical professional is going to write a recommendation for a patient, a lot of times with the seniors, give some guidance, because the one that we always hear is, "Yep, if you have any questions, or we'll see you next year for a renewal." And I just think they're not getting the information from the dispensaries. No disrespect to dispensaries, but I'm not a medical professional. They're not medical. In most cases, aren't medical professionals. They don't know if they're diabetic. They don't have a heart arrhythmia. They don't know what other medications are on. And again, it's not just a one size fits all or the daily special. Start selling these, like you say, in the recreational. I hope everyone makes $1 billion in this world and industry, but do it the right way. And I've seen the recreational market push out some great doctors that have had to close their practices down. Maybe they had one or two offices, and now they're down to one office. Now with COVID, doing stuff like this, they had to close their final office down. So it's changed, and hopefully stuff like that changes. Do you still see patients face to face, or are you kind of doing stuff like this?
Right now, I've just been virtual, although I was even doing a fair amount of virtual before the pandemic started. And these issues, I would say for me personally, they haven't impacted me greatly because the bulk of my time these days isn't patient care, whereas 3 years ago, 95% of my professional world was patient care. Now I do much more teaching and education and kind of working with folks. So I'm not reliant on patient care to kind of sustain. It's more of a select, folks by referral or find me and, hear me on talks like this. So for me personally, but some of the other good high quality cannabis physicians that I know in Colorado that, patient care is really their whole business. They've definitely been impacted. And again, it just creates a cycle. If you have people starting cannabis without guidance or with guidance just from an untrained dispensary worker, well, then they're going to have more risk of side effects or problems. And that creates a negative image. They're going to have less likelihood of success. And that also creates this negative image, and it kind of feeds back into a lot of the false propaganda that's been out there about cannabis for 70, 80 years. Someone who just goes to the dispensary and they say, oh yeah, here's all these concentrates, and now someone's using way too much or having side effects or builds up a tolerance and it doesn't work. I mean, it just creates this false cycle if you don't get good education and guidance. And certainly I'd like physicians to be a part of that, but there's still a whole bigger world of good educators that don't have to be physicians. And so I'd rather see us collectively kind of identify who those groups are, whether it's, nonprofits like yours, and there's some other great nonprofits that really do good quality cannabis education, help people connect with physicians in certain situations. So I don't think everything has to be kind of physician only and then the physician disseminates, but I think we need to have some, acknowledgement of, or, here's folks who are really putting out good information. And that's kind of what I do is I kind of go around and I learn who's putting out good information, learn groups like yours that I can direct patients to, because maybe someone doesn't want to, they can't use insurance for these types of things because it's not really fitting. And if someone's going to need 6 months, they probably can't afford to see me every 2 weeks for 6 months out of pocket. Certainly not these days with the economic issues going on. So I think we have to utilize all the different groups and really the folks who are, I guess as we like to say, doing it the right way, which obviously is up for debate. What's the right way? But usually when I talk to somebody, I get a pretty good gestalt, at least if they share my philosophies. And if they share my philosophies, that just becomes kind of part of my circle of where both I can work and educate people through, but also I feel comfortable referring patients, family members, friends, and whatnot. So I think I want to see that network grow. And I think physicians are a major part of it, but I don't think they're the only part of it.
Yeah. You said debate, and the debate, this one always comes up. I want the medical part of I don't say medical. I always say medical part of the plant, meaning versus recreation. A lot of people say I want the medical part, which is CBD, recreation, THC. That's not where I was going with this, but the difference of medical grade quality cannabis versus recreational quality cannabis. Is there a difference, or is it just taxed differently?
It's not in Colorado. There's no difference. I can't speak for other states.
I don't think there's a difference. That's why I was asking.
In Colorado, Literally, usually the plants are growing side by side in the dirt, and one has a barcode on it that says med, and one has a barcode on it that says rec. So in Colorado, no, you can walk into any dispensary and feel, I think, pretty confident of quality.
Yeah.
And other states, again, that since there's no, of course, oversight federally, every state is doing its own thing. So I don't know necessarily product quality in other states, but in Colorado, no, there's no med quality and rec quality. The differences here are just taxes, which is pretty substantial, like almost 25%. So
yeah, I was gonna say, one time we were there, and next thing you know, it was $100 something. I'm there like, we just grabbed this. I said, well, you're out of state. I think it was 22. It's probably 25% tax. And so a lot of patients asked me that, and I said, you know what? In Colorado, as far as I know, it's people get a medical card. Same thing in California. You get a medical card to help on the taxes, but the product is the same. So you write in recommendations. How easy is it for a Colorado resident to come in and get a medical card, and how easy is it for a non-resident Colorado resident coming in to get a medical card? Because a lot of patients we work with on a daily basis live in illegal states. And I say, before you become a cannabis refugee, go to a legal state, that you're able to go in there and see if this even works. Colorado, a lot of them are coming from, most states that are illegal are closer to you than they are to us. And so I always direct them to Colorado. Is that something that an out-of-state patient can get a medical card? Where California, it used to be the way you can have a U.S. birth certificate to get a California.
Yeah, no, in Colorado, to actually get a medical certification, be able to go to med dispensaries, and the benefits that come with that, you have to be a Colorado resident. You have to have a Colorado driver's license. I definitely see and consult with people either who are living in Colorado but not yet residents, or live in other states, and certainly can give guidance. And again, in Colorado, if you can get past the cost issue and the taxes, there's no, like I said, most sales are on the rec side, and there's a lot of good quality companies that don't even sell on the medical side because, again, it's more profitable. So you can still come in for a consultation if you aren't a Colorado resident, and purchase good quality products on the recreational side here. If you are a Colorado resident, I usually say there's no downside to getting your med card, because it just gives you more options. If the products you want are available on the med side, well, then it's going to save you money and make it easier for you. Likewise, a lot of dispensaries, they don't always publicize it, but a lot of dispensaries will give medical patients a discount. So if you're a rec-only dispensary, you don't have a med side, often that you might give a discount of 10, 15, 20% to a medical patient. So it's always, I think, worthwhile to have the card, and then for documentation as well. But in Colorado, again, quality is the same. So if you're a resident, great, get a med card. If you're not a resident, you still can get good education and still get all the products you need. Hopefully, at some point, I think what most of us would like to see is everything be unified. There's no med or rec dispensaries or med or rec products. There's just one dispensary. And if you have a med card, you have these rules. If you don't have a med card, you have different rules. Yeah. But it's all the same. It's all the same door. It's all the same product. And it's easier for companies to streamline their growth. So we've been trying for that for a while, but there's a lot of things we've been trying to do in this industry that makes sense for the patient, but don't always make sense for whoever's making the rules.
Yeah, and it's disappointing, like you said. Rec door, you walk in the main door, but you have a recreation door, the medical door. Other states, Massachusetts, they will keep an allotment of product for their med patients if they run out with their recreational patients. And a lot of patients don't want to get. Are you in the system when you get a medical card? Like the DMV system, and so I think a lot of
not DMV,
not DMV for police
in Colorado. In Colorado, I mean, not being an attorney, I might miss up a rule. In general, the only thing that's come up is concealed carry. So Colorado has concealed carry law, and I definitely have heard people who want to have a concealed carry, generally we recommend they don't get a medical card, because whoever deals with concealed carry permits, I think, can crack into the database there, which is a problem in its own right, but that's the way it is. Other things, there are people who just don't want to be part of the system, and that's their general philosophy, but I don't think that's really it's not a huge concern of mine. So, I mean, I've had doctors and lawyers, other professionals who have med cards who have never had problems or concerns. So really the only one that's come up is concealed carry.
Or even owning a firearm. You know, a lot of Montanans, you know, were hunting, and Coloradans were hunting as a way of life. You know, they can't have both. They, you know, federally illegal. They're having a firearm, not concealed carry, but just having a firearm. You know, they're breaking federal law. And I think now the application says, do you use cannabis? Are you a cannabis patient? Yes or no. This is a legal document. And so I think that's why a lot of people don't want to be in the system. And what's going on in our world right now, I think a lot of people just want to stand back and not be in anyone's system. And it's funny, as throughout our podcast here, not even saying SIRI, Siri, my iPhone has been popping on. I haven't even been saying so.
I'm worried to know what might be showing up on an iPhone.
Yeah.
So I mean, it's pretty horrific stuff that obviously happened yesterday, but I would say, for those of us in the cannabis industry, for those of us who have certainly no cannabis history and criminalization history, you know, we've already seen the damage of what certain philosophies can do to people and lives, and the differentiation in social equity and racial inequity. So kind of the events of even yesterday, I think for those of us who are embedded in the cannabis space aren't sadly that surprised. I mean, that's more of a sad state of our country, but we've been criminalizing people trying to do what they need to do for their health and well-being for decades. And we've kind of, again, say, this is the way we say you have to follow. And if you don't go down this path, you're a criminal or you're an outcast and you have no rights. And so we're kind of used to these problems, I guess I would say. And sadly, I wish I would be shocked by some of the bad news that comes out, but I'm not so much, because,
you know what, I think
it's a way of life, and for those, you know, who know cannabis history.
Yeah. You know, and my shock factor is kind of numb these days. You know, it's like I don't want to say nothing surprises me, but sometimes it doesn't. I don't know if things that have happened in my life recently with passing and what's happening with government and laws and seeing patients. And so hopefully things do get better. How do people find you?
Best way for people to find me is just my website, 4pillarsdenver.com. It's the number 4, and then Pillars, Pillars, Denver.com. That's my website. So if someone does want a consultation, easy to schedule from there. If they just want cannabis education, I've got links to talks like this that I've done, links to podcasts, links to lectures. There's some nice cannabis 101 lectures if you want to spend anywhere from 20 minutes to an hour just learning the basics of cannabis. There's recordings there, and so that's certainly the best place. All my social media tags are 4 Pillars Denver. Yes, 4 Pillars Denver, although my social media presence is modest at best. And maybe at some point I'll expand, but probably not. But those resources are out there. Certainly the links when I'm on, you know, shows and things like that. So either www.4pillarsdenver.com or just 4 Pillars Denver as far as most social media platforms.
Cool. I'll make sure I put all that stuff up there, and you do have some great articles on there and some graphs on your website too. So if you haven't had a chance to take a look at Dr. Dave's website, any closing words for our audience?
Closing words. there's a lot
I
of
threw
things
that on
I
you. I
could
threw
say
that on
on yeah, we're recording this on January 7th, 2021. So there's a lot that I could be said, but I'll just reiterate that really I think cannabis, not just, and integrative medicine in general, it's a different paradigm than what we're taught. And I think we have to acknowledge that kind of what we're taught and the dogma in so many areas is frankly inaccurate. At best, it's inaccurate, and at worst, it's just completely destructive for so many different people. Whether it's, again, when you're talking about what we're taught in terms of our history and social equity issues, or it's dangerous to people in terms of what the standard of care is, which is harming a lot of people in medicine. So I think cannabis is a great example of that harm that can come if you just follow a set dogma that really doesn't listen to the facts and doesn't listen to the science. And so get your cannabis education, get your education on integrative and functional medicine, but recognize that's just a gateway to kind of acknowledging the deeper layers of what's out there in our culture. And the more you learn and the more you acknowledge, the healthier and better off you'll be, but the more able you'll be able to help others as well. So I'll leave it at that.
Pay it forward. Education is key. I appreciate you, Dr. Dave Gordon, and great to see you again. And I thank you for taking time to be on my show once again. So everybody, this is John Malanca with United Patients Group. Be informed and be well. And wishing you all a blessed and safe and happy day. And David, thank you so much.
Absolutely. Thanks so much for having me.
We'll see you again.